Hello, Mr. Jones. How are you?
I'm good, how are you?
Good. My name's Dr. Gramlick. What have you come in for today?
You can just call me Daniel, by the way.
Okay, Daniel.
What's your name?
It's Dr. Gramlick.
Yeah, I'm a bit tired. I've been having some problems. Some problems.
Okay.
Yeah.
Would you like to tell me more about that?
I guess I have to. So I've been going to the toilet and, doing a wee.
Yep.
And it's kind of, the pee's kind of looking a bit funny and it kind of hurts.
Okay.
Yep.
Mhm.
And, I don't think this happens. No, it's not really, it's not normal.
Mhm.
At first I thought, because I got like red tiles in my bathroom.
Yep.
So I thought maybe, I've thought this before, but like, might have been, the wee catching the colour and looking a bit funny, but then, I realised that's not the case.
Okay.
Because it kind of looked a bit strange in the toilet bowl.
Yep.
Yeah.
So what do you mean by it looks strange?
Yeah, it's kind of not, like I drink a lot of water and stuff, so it's normally pretty clear.
Mhm.
And when I drink water, then it'll be yellowy. Now it's kind of not. It's kind of brown.
Okay.
A little bit brown. Yeah, and it doesn't really hurt.
Okay.
If my actual penis hurts.
So tell me a little bit more about that, the pain aspect of it.
Most of the time it's alright. It's not like it's hurting all the time.
Mhm.
Yeah, when I go to the toilet to do a wee or whatever, it's kind of burns.
Okay.
Yeah.
Yeah. Okay. So how long have you been experiencing these symptoms for?
It's been about 3 weeks. Thought it'd go away, but it's kind of just, it hasn't gotten worse or anything.
Yeah.
I thought, 3 weeks. It's a good time to get some professional opinion.
Yeah. I'm glad that you come in to see me about it.
Yeah.
So did you notice, or do you have any ideas about what you think might be the cause?
Not really. I don't know. How do you normally get these things? Like, I keep it all pretty clean down there and stuff. I'm kind of anal about cleanliness.
Yep.
So, I don't know. It shouldn't be that. Like, I checked it all around and it looks pretty good.
Okay.
Yeah.
So there could be a few kind of causes of a symptom like this. It sounds like there might be a little bit of blood in your urine, which we can test. We can do a little dipstick test later, which is very simple. And if there is blood in your urine, there could be a few causes.
Okay.
For something like that. Have you had any trauma? Like, do you play sports or bike riding? Or?
No, I don't think I would have had any trauma. I do bike ride every day.
Okay. You haven't done any big long cycles?
No, I just ride to uni. It's like
Okay.
15 minutes.
Yeah.
The road's a bit bumpy, but like, it's not a big deal. I don't think.
Yeah. Well, another really common cause of symptoms like this is to do with your sexual health.
Okay.
So is it okay if we have a bit of a discussion about that?
Yeah, sure.
Okay. It'll help me get a better idea of what might be the cause.
Yeah.
If you're uncomfortable talking about this, then we don't have to.
Alright.
And you can let me know.
Okay.
Okay.
Guess you need to know.
Yeah. Well, yeah. If
I want to get rid of it, obviously.
Exactly. You want to find out what the problem is here. Yep. So, do you have any sexual partners at the moment?
Yes. Yes, I do.
Okay.
One
partner?
Yep.
Mhm. Is that a relationship?
Yeah.
An ongoing?
Yeah, I'd say, yeah. Yeah, we're in a relationship.
Okay. And when did that relationship start?
It's pretty new. It's been about 3 months.
3 months. Okay. Have you had any other partners in that time?
No.
No?
Only this one person.
Would there be any possibility that that other person has had any partners in that time?
I don't know. Maybe. I'm not sure. I haven't asked them about it.
Okay.
Yeah, I hope not. I doubt it.
Yeah. Okay. Do you ever engage in anal sex?
I would say almost every time.
Okay.
Yeah, because it's the boy.
Okay.
Yeah.
And do you use condoms or barrier protection?
Sometimes.
Sometimes, not all the time.
Not all the time.
Okay, because that can be a way that STI or sexually transmitted infections can spread easily.
Okay.
As if you're having sex without a condom. Any type of sex, it doesn't have to be anal.
Alright.
Okay. Another question that I should have asked before is, have you ever had these symptoms before?
No.
Not at all?
No.
So you never normally have burning when you urinate?
No. Not that I can remember.
Okay.
So.
Yeah. And have you ever been, has anyone ever told you, a doctor ever told you that you have any kind of sexual infections?
Don't think so.
Okay.
I don't go to the doctor very often.
Yeah. Have you had sorry.
Yeah, I'm usually pretty, I'm quite fit.
Mm-hmm.
I really do try to eat well and
yeah.
take care of myself as much as possible.
That's good. Good to hear. Have you had a sexual health checkup before?
No.
Okay. So before we sort of figure out what we're going to do about this, I'll just summarise everything to make sure I've got it all right.
Mm-hmm.
Let me know if I've got anything wrong.
Okay.
So over the last few weeks, you've noticed that you have your urine's a bit of a funny colour and it burns when you urinate.
Yeah.
You're not really sure what the cause of this is, and that's why you've come to see me. You do have, we don't think it's any other from a cause like trauma or cycling or sports or anything like that. So the aspect that we're looking at is a sexual related problem.
Uh-huh.
Your partner is a relatively new partner. You've been together for a few months, and as far as you know, neither of you have had any relations outside this relationship.
Yep.
Okay. You've never had these symptoms before either. Okay, so this is a very common problem. I'd like to say that just so that you understand that these sexually transmitted infections, which is what it sounds like, are very common, and I'm glad that you've come to see me about it because it is important. So what we want to do first is establish that you definitely do have, or which type of infection you have. So to do that, we're going to do a urine test, if that's okay.
Okay.
It's very simple. You just pee into a little cup and then we can analyse that. Mm-hmm. And then we'll do a blood test as well. And we'll look for certain infections in that.
Okay.
How does that sound?
Yeah, sounds good.
Yeah, so these are pretty simple tests, and once we find out what the problem is, then we can treat you with the right kind of antibiotic.
Okay.
There are some infections that we can't treat, and if you do have one of those, then we'll have more discussions about what we can do about that and how that might impact it on you.
Okay.
One of the diseases that we'll be testing for is HIV, which you've probably heard of. Yep, and we'll test you for that because you are in an at-risk group because you have anal sex, and HIV is more prevalent in the homosexual population in Australia.
Alright.
Yep, so we want to make sure that you don't have that. But if you do have that, if the test does come back positive, there are medications that can make it a really manageable disease. Do you have any questions?
Should I not have sex until everything's clear? Or can we just keep doing our thing?
I think you can continue. I would advise always to use a condom, regardless of whether you're having sex with a male or a female or any kind of intercourse. It is important to use a condom to prevent these diseases from spreading. So I'll just recap to make sure we've got everything and you understand what's going on. So we've already talked about your symptoms and the causes that we think may be involved.
Okay.
Our plan now is to have some tests some simple tests. So I'll write you a form for that, which you can take to pathology.
Yeah. And
they'll take your blood. And I'll give you the cup for the urine test, which you can just leave with our nurse. And if you can make an appointment with the receptionist for about a week's time, come back and we'll discuss the results and see if we need to do any treatment.
Okay.
Yeah. How do you feel about all of this?
Oh, that sounds good.
Okay.
Should I do that now?
Yeah, I'll get it for you in a minute.
Yeah.
Alright. Thank you very much for coming in, Daniel.
That's all right.
If there's anything else you need, please let me know.
No, I think that's all.
Okay.